I'd like to welcome you all to today's Lunch and Learn webinar on GP Connect. My name's Donal O'Neill. I'm the head of marketing for OneTouch, and with me today, as always, I have Dan Jarman, our implementation consultant. And today we are actually delighted to be joined by some people external to OneTouch. So it's a monumental occasion on our Lunch and Learn webinars. But with us today, we have Steve Sinnot, who is the Group Head of Quality and Compliance for Alcedo Care. Hi, Steve. And we also have Alison Taylor, who's Senior Program Manager for GP Connect for NHS England as well. So the goal of today is really to talk to you guys about GP Connect, what it is, how it works, how it will help you. So the agenda for today is Dan is going to run through kind of the GP Connect story from the OneTouch side of things and sort of how you can sign up, etc. Then we're going to pass it over to Alison, who will talk to you about GP Connect from the NHS England point of view and the overview on that side of things. And then just so that you guys can sort of learn from what Steve has done as one of the early adopters that we've had for GP Connect, I'm going to ask Steve some questions about how he's kind of found it and what kind of worked well for him and things like that as well. So we hope it's going to be a really informative session for you guys. And as always, we'll take some questions at the end. So if you do have questions, you'll see on your screen there's a little comment box with a question mark in the middle of it. Click into that, type in your question, that'll come through to me, and I'll do my best to put it to the guys once we've gotten through each of those bits that I outlined there. So that's the format and the flow for today. So without further ado, I'm going to give the controls over to Dan, and I'm going to make you the presenter, Dan. That should be on its way to you. So you should have that now, and take it away, Dan.
Perfect. Thanks very much, Donal. Yeah, so I'm Dan, everybody. I'm an implementation consultant with OneTouch. You've probably seen me on these webinars before. Like we said, first thing that I'm going to talk about today is we're just going to give a brief overview of GP Connect and kind of how it helps you with regards to the use of it in OneTouch, okay? And then obviously we will hand this over to Alison, who's more in tune from the NHS perspective, and Steve, who actually uses this on a daily basis. So first and foremost, I just really want to quickly walk you through what GP Connect actually does inside of OneTouch and why it makes such a big difference for teams using the system. In simple terms, GP Connect lets us see important information from someone's GP record directly in the OneTouch platform. So there's no more waiting for paperwork, there's no more calling GP practices, there's no more guessing whether the info that you have is accurate and up to date. It's all there, pulled straight from the source. The big win is that it gives you a much clearer picture of the person that you're supporting. You can see things like their medications, allergies, conditions, basically the things you need to know to look after someone properly. It helps you make better decisions and, most importantly, keeps people safer. And of course, it saves a lot of admin time. Instead of chasing practices or waiting for somebody to email over a medication list, you just open OneTouch and it's right there for you. It makes day-to-day work smoother for everybody. It also helps different teams work better together as well. If everyone has the same access to the same accurate information, care becomes a lot more consistent and much easier to coordinate. Now, there are two different types of access to GP Connect within the OneTouch platform: standard access and clinical access. This is to make sure that people only see the level of detail that they need to for their role. Standard access is ideal for your non-clinical staff. So people like care coordinators, managers, admin teams, they can see the essentials such as medications, allergies, key conditions. It's everything needed to plan care properly without going into more clinical detail. Then you have your clinical access, which is for your registered clinical staff. So nurses or anyone who needs the deeper information to make clinical decisions. On top of the basics I just mentioned, they can see things like consultation notes, coded entries, which give a fuller picture of somebody's health history. In the end, GP Connect just makes life easier. It gives your teams reliable information, reduces the back and forth with GP practices, and helps everyone make safer, quicker decisions. And for the people receiving care, it means they don't have to repeat their medical history over and over again because it's all right there for you to access at the touch of a button. So that's GP Connect in a nutshell within OneTouch. Simple, fast, safe, and it's a big boost to how OneTouch supports you and your teams. Now, what I'm going to do is I'm going to share my screen with you, and we are going to actually look at where it actually sits within OneTouch, okay? So sharing my screen with you right now, you can see the main dashboard of OneTouch, which you all working on a daily basis. One thing that we always say with regards to how you navigate around here is that your left-hand navigation bar is your best friend, okay? So if I'm wanting to see the dedicated medical history, GP Connect, for a particular client, it makes sense that I would be within that client's profile, okay? So many different ways I can get there. Over on the left-hand side from here, I could do a quick search to get to somebody's profile. Now, if I just search for someone in particular here, say Richard, and I navigate to his profile, looking down the left-hand navigation bar, what I have is the GP Connect option available to me. Now, when I actually do click on this, because this is restricted information, we can't actually display it to you, okay? Because this is Richard's medical history. But as you can see, this is how the data would sit. It sits under multiple different tabs along the top. A lot of these as well actually have date ranges where you can search for particular entries that you may need to see, okay? Now, what I actually do have is I'm just going to show you a quick slide deck here of some information that we put together so you can see how that information would actually display. So let me just find that one for you, and here we are. So this is how the information would actually show up, okay? So as you can see, we're in GP Connect on my left-hand navigation bar. In the summary context just here, you can see date entries with all the information that you would need. Again, it would be the same for allergies, the same for medications as well, with your date range to be able to search out those entries, and same again for immunizations. Obviously, there will be more tabs available if you had the clinical access as well. But that is essentially how it works within the OneTouch platform. Alison will be able to speak more clearly on this from an NHS standpoint. So if you would like to take back control, Donal.
Yeah, I'm just doing that now. Bear with me for a second. 2 seconds. Share.
Will I just come in?
Yeah, go ahead, Alison. Can you guys see that PowerPoint presentation there?
Yeah.
Great. Let me just go into present mode. And sorry.
That's all right. I'll just start introducing myself. So thanks both. Or are you going, Donal? Is it me or is it you?
No. I was just going to say a quick thanks to Dan for that overview. But now, Alison, yeah, I suppose, look, what we're really hoping for you to do today is just give us the NHS overview and that sort of thing. So just shout at me when you want me to move on to the next slide, and we'll go from there.
Brilliant. Thanks both, and thanks for the invite, and it's great to see so many on the call. I think I must say, Dan, I'll give you top points for the overview and why we're using it and why we're doing it. It's always good for me to join these calls because I've been on this journey quite a few years now. I think it's 4 or 5 years when I started back in primary care working with GP Connect, and then wanted to bring it to social care for all the benefits you've said, Dan, and some of the benefits Steve will talk about. I'm going to briefly run through these slides because a lot of it is repeating what Dan said and actually agreeing, which is why we're all here. We want you to jump on board and start using this to make your everyday life better. What I should say is I do get where you're coming from. I am a nurse. I still work twice a month in a nursing home as a nurse, and I love it. And it keeps reality, because that's what keeps me doing this job and making improvements and driving change. This is just a baseline. There's so much more we can share once you're on this journey, and obviously you're on the journey with OneTouch as one of our assured suppliers, which is amazing. And I work with all the suppliers, which makes this such an amazing project, because we want all care providers, irrespective of systems, being joined up to get the information for the people we care for. So next slide. I think Dan did a great job of explaining what GP Connect is, which is sorry, agenda slide we can skip, Donal. I forget some of these slides that I go through.
Yeah.
So like Dan said, it definitely is lifting information out of the central system that holds information about us all and people we care for with the appropriate staff. And there's some prerequisites to having this data, which I shall go through as we work through the call. The first one you've already got, that's why you're already on this call, listening to us about why you should be joining the train. The next one is the DSPT. You may have all heard of that acronym. I'll be surprised if you haven't. The Data Security Protection Toolkit. It's to protect you all in that cyber security world that we now live in when we're sharing data. And it's essential if we're accessing NHS medical information. And the National Data Sharing Agreement, which is the other step that you guys need to do as providers, is agreeing to this vast amount of information that you're going to be getting that helps your everyday life. I'm saying it's vast because you've never had it before. So once you've got it and used to it for a while, believe me, you'll want more, because I want more. And every time I use it, I want more. But we're on a journey, and this is the start of the journey. The National Data Sharing Agreement started about 4 years ago to make it this easy for you guys, and I can honestly say it is really easy. Hopefully Steve won't tell us about any nightmares he had. Hopefully it was a seamless process. But overall, it is pretty seamless process, and I'm not saying it's 100% perfect, because there will always be people that have issues or something in the back end doesn't connect. For example, an ODS code that I'll speak about as we move through the presentation. What I will say is it's nothing to worry about. If you're on the DSPT journey, and I say journey because some of you might be in very different places, and it's a very common issue with providers nationally. Some get on the journey, forget to re-register, don't keep up to date, or you've got some that haven't joined the journey and need that support. Either way, NHS England have got teams to give contacts to our assured suppliers. Obviously, Donna will share the Better Security, Better Toolkit program that is out there, nationally funded, for providers to get free support to actually implement and review and update and keep up to date with this DSPT, because it's so important for this interoperability journey moving forward over the next few years. I think I might have put in a link later, but we'll see. Move on for me, Donald, please.
Yeah, you have, Alison. I'll spoil it. You have.
Okay. So who can access for what? Again, Dan explained, it's role-based access control. This is for you at local level to say, I know what my people do. I know who needs to see what. This will help this person. This will help that person. Under GDPR, the legal basis is direct care. So as long as there is a correct reason that you're seeing this data to look after people, you seriously have nothing to worry about, especially if you sign the National Data Sharing Agreement, which also writes the legal basis for you. I know it writes it for you because I wrote it, and it's now in a system that you just agree to it. If you don't agree to it, you obviously won't get data sharing, but I've tried to make it as simple as possible. Now, some of these roles that are on there, Dan again explained the two different access, and I've put an example of nurses on there. Physiotherapists can get access, they've got professional registration. Paramedics, CQC, we can go on, but at local level, this is how we're building up that trust and that baseline and of sharing information through our assured digital social care records. The non-clinical access, as Dan spoke about, is the filtered access from the full record. Now, being a user of GP systems and seeing the full record, this is why I designed the filtered access like it is, and starting them building blocks, because you really don't want to be trawling through coded data that GP systems view is not great, whereas the systems you use is intuitive, colourful, you know what you're doing. So we want to integrate those systems to make it easier. That list is nowhere near exhaustive of the roles that might be using this out there, and Dan actually said a few other names that are not on there. Coordinator, I remember, but through other roles that are out there that will be using this information. The most diverse person I've seen using this information is actually a gardening guy that was in a care home, and he come to one of these webinars, and through the power of having, say, an experience in his personal life of not getting information from somebody that he cared for, he knew he needed that information about the people's allergies being in the garden. So he prompted the home manager to work with it, and it can be as powerful as that. And those little changes for our residents really make me smile, and that's why I do this job, for accessing information for everybody out there. I won't go over the access of the pictures that are at the bottom there. Dan did a great job of showing you that really in OneTouch. So we can move on Benefits, I think actually Steve can sell the benefits, hopefully, because I know the benefits. I wouldn't be here if I didn't. I wouldn't keep working with it. Dan mentioned some of them. The biggest one for me working out there is reduced phone calls. The ones in yellow, I have actually recognised all them benefits, but still working on the shop floor. The one for me when I get an admission or need a discharge is to reduce those phone calls between probably 7 or 8 different stakeholders that actually look after one person in that wider setting for care, from hospital to community to ophthalmology, you know, the list goes on. And I'm not going to read that slide out to you because I think hearing it from Steve brings it more alive. So if we can move on, Donald, that'd be great. Again, these are some of the testimonials that we've had in when we've done some connection with the guys on the webinars, and they've just reiterated what we've said about the benefits. Again, I don't want to talk through these, but the one that's impactful for me is I've heard throughout my 30-odd year career, I don't want to bother this one, I don't want to bother that one, and not being empowered to actually ask the silly questions or ask for information. But with this, people don't have to feel like that, and it empowers them again to use digital, do their everyday work. And actually a carer to go to a nurse and say, look, I've got this information, what can we do about it? This will improve the care. It's all happening out there and building those relationships. So for me, that was really impactful. All the rest, I think you'll see different challenges, and you'll be able to probably give me a list of testimonials, Steve, hopefully, that would support this. So I'm looking forward to handing the mic over to you. What's my next slide, please? National data sharing agreement, the biggest thing that worries us out there around consent. If we can move on, Donald. Try and be very short and sweet, because I can honestly say, do not worry about this. So the National Data Sharing Agreement, both briefly said earlier, and you did mention it, Dan, around the agreements and the things that are in place. It's a legal signed contract. Do it once, you haven't got to do it again. That is the biggest impact for us all, because I know even working a couple of weeks ago, I think I asked consent of a patient and a family member and God knows who about 3 or 4 times, so that it got written in a written care plan, but we use an electronic med system. So I absolutely hear you out there with your current frustrations, but getting this in place really will help you for the future and getting more. I've spoken about the DSPT again. There is information in this deck around going to get some help if you want that guidance. And obviously the guys on the call are here to help you, Donald and Dan, within OneTouch will certainly give you some support. The application process, which is the portal as I've referred to it, you need to be ready with your ODS code. If you haven't got your ODS code now, though, there's been an upgrade to the portal that actually, when you're in it, if you don't know it, you can click on another button, takes you to the search page. As long as you put your postcode in, it will bring you up your ODS code. So that's an enhancement I've been waiting for a long time for. And I can honestly say it works now. So if you're not got that in place, however, if you've got it, it just quickens your process. So it's one of the things you'll need. The portal link is at the bottom of that slide. And I just encourage you to go and do it. And if it is bad, please let me know. But I really do think it's quite easy and it's a really good process to go through. Next slide, please, Donald. This is just a resources slide. So everything that I've spoken about, everything that Dan's touched on, I'm sure things Steve will touch on, is here. As a team in Digitising Social Care, which is the bigger program that supports this, there's a website. And that's on there, and that's got an awful lot more information about the bigger picture, what we're doing with DSCRs, and you know what the next future is around linking up interoperability, which this is a massive big baselining start for OneTouch, massive achievement, and I'm really excited that they're on board and this journey is going to soar in the next few months, because you're all going to come on board. I'm sure that's my last slide, because obviously I think it was questions. Yeah.
That's it. Apologies.
Yes.
Give me 2 seconds here.
So thank you very much. And I think I'm handing the mic over to Steve and Donald.
Yeah, so thanks a million, Alison. That was great, a great overview, and I think what's always kind of impressed us in working with you is your level of experience and how you've kind of brought that to the fore and used it to help guide this project kind of from the outset. So it's great to have you on board. But we also wanted to give everybody just an overview from the user's point of view and someone who's actually using OneTouch and someone who kind of was our earliest adopter, and that's Steve Sinnot from Alcedo Care. So Steve, first things first, you might just give us a quick overview about yourself, your role, and then sort of why GP Connect was so important to you.
Yeah, sure. Can you hear me okay?
Yeah, all good.
Yeah, cool. So Alcedo Care, we're a large care provider in the northwest of England and in North Wales. We have around 700 clients across 24 branches. So quite diverse. 60% of our clients have complex needs, and about 350 of those clients require us to support them with medication. So there's a lot of traffic, if you like, on medication changes, keeping up to date with changes in their medical conditions, keeping on top of that side of things because of the complex nature of the support that we're delivering. And of course, people living in a home care setting, in a domiciliary setting, more in and out of hospital as well. So we have quite a lot of changes in circumstances. So we had a lot of, that's the contacts that we're working in. And we have a small team of nurses, registered nurses, who support our staff on the ground in terms of nurse-based training for the complex competencies, but also the nurses provide us with transcribing training. And one of the huge benefits that we've gleaned from having GP Connect is the accuracy and instant access to current medications and repeat medications, particularly when you're transcribing, because it gives you instant access to a second source. So you've got the label and you've got the GP record, so you know that it's the correct information. So we've seen an increase in accuracy on transcribing, which is really great. The instant access to medical history is a huge benefit for us, including conditions, allergies that Dan mentioned earlier, because that helps us to improve our risk assessments when we're assessing people's needs, because very often we get referrals, but with very scant information on it. So for us, having access to the direct source for medical history is really crucial, because generally people will forget that they've had certain things happen to them. So that helps us with our risk assessments around delivering safe care, and particularly around moving and handling. I guess the team would tell me, that the people on the ground would tell me that the huge amount of time that they now save on doing regular monthly checks, such as we have a process where we ask the staff to run a label check every month of medications in the client's home, and we used to ask the GP for a summary, and the GPs absolutely hated us calling because we were literally on the backs every month. So now that's all gone. We've got instant access for people who have given permission for us to view, so that helps with that. MAR auditing is a lot easier. And of course, the time saving on phone calls, email traffic is down, and of course our nurses have access to the higher level of information for when they're looking around referral information, observations on the clinical side. So that's a quick summary of the main benefits that we've discovered.
That's great, Steve. No, thank you very much for that. And then I'm always curious about kind of changing processes and changing workflows. So how you might tell us a bit about how you kind of went about rolling it out to the wider team and kind of getting their buy-in into it and sort of changing the way that they use the OneTouch system with GP Connect.
Yeah, I think this is probably the easiest thing that we've had to sell to the team, because they were, as soon as we mentioned we were piloting it with OneTouch, the first question I was asked is, when can we have it? Because literally it revolutionized the operational side of things at branch level overnight. And I think we introduced this in around May time this year, and since then the amount of times I've spoken to people and they absolutely love it. So in terms of rolling it out, because we're quite a diverse team, we do connect face to face, but we're primarily reliant on technology. So but it was quite easy in terms of rolling this out, because all it is a touch of a button. It's not a complicated procedure. You literally press the button. If you've got a valid NHS number in there on the client record, then and they've consented to the record being accessed, you'll get instant access to that information. One of the things we did do was we made sure that we reinforced what the rules are, in terms of you've got to have a legitimate reason for viewing that data. You can't just go onto somebody's record because you're interested. You have to be, the purpose has to be either you're reviewing somebody's history for an assessment, or you're reviewing their medication records, because the system does log every time it's accessed, from the NHS side. We're aware of that, and we're made aware of that when we sign the data sharing agreement. So yeah, we gave them a quick demo on how to access it. And I guess the only downside for us is it isn't currently offered in Wales. So much as I tried to liaise with the NHS in Wales, the answer that I got back is that it's not currently, there aren't currently any plans, which is a shame, because it means that our branches in Wales don't have the same access as the branches in England. But that's the only negative that I can come up with.
That's a good way to look at it, if that's the only negative you can come up with. And in terms
I
of
can't argue with that negative either. I absolutely appreciate it, because I've been fighting for Wales Island, Channel Islands for quite a few years now. So it is in the conversation, but just getting England done is task enough, which we've taken on over the last 3 or 4 years. So I hear you, Steve, and I think it's more powerful even cross boundaries, because of the huge amount of travel we do nowadays, and in our elder years. So research shows us that we need to share data, not just between ourselves, but internationally. There's an awful lot coming around the single patient record that suppliers, and we're all signed up to making better. So I really hope, Steve, in the next couple of years we can start sharing across the borders to make it available, because where you're using EMIS and TPP, it more or less is just a governance issue around changing that data sharing agreement.
That's right.
I think we can do that, but of course we need the resource and everything behind it. So I think what we do in England will certainly benefit the other countries, and I'm so behind. Yeah, if that's the only negative, we know about that, so that's great, and we're working on it. But yeah, I do feel frustration for them. Yeah, but it's great to hear you speak and say everything you've said, because it just makes all the hard work worth it.
Excellent. And look, we've had a question in from the audience as well. So Steve, just asking, did you write to GPs and clients for consent, or is this done automatically via the integration, or how does that work?
Okay, so in terms of from the client perspective, we made sure that as a matter of course anyway, we were already obtaining consent per client for access to their medical record information, because that's just the way that we worked anyway. If we were to access somebody's GP summary, we would need their consent to read that information. And we have an express consent form on our system that we use, and we get the client or their legal rep to sign that to say they agree to us accessing their medical records, or indeed they may not. They've got a right to say no. However, that does make our job more difficult when we come to the safe delivery of care and assessment. So there's a discussion that you might need to have then around why you need that data and how important it is. Or they might give you express permission, but with some exceptions, that you don't share it with X, Y, or Z. So that's easily documented in a simple consent form. On the GP side, that's not our role. The GP obviously will have an agreement, I understand, with the NHS, and then that's where we sign our data sharing agreement with the NHS as part of the onboarding of this system. One thing we do need to make sure is that you data cleanse your client base to make sure that you've got valid NHS numbers on everybody's profile readily available, because it won't connect without that, because that's one of the validating fields. So make sure you get your information in order. And I would also say make sure that you update your privacy notices in every place that you've got one. So not just on your website, but also on your terms of business. If you have a private contract with a client, you've got to ensure your privacy notice states that you may need access to their GP. You may access their GP record, but also in your financial information and your customer guide, depending on what type of service you're offering. I mean, we're registered with the CQC and the CIW. CQC, we just make sure that all of our documentation includes that updated privacy notice.
Excellent. And guys, we have a few more questions coming in, but just a reminder to anybody, if you do have questions, drop them into the questions tab. You'll see the little question mark in a box there. And then the other thing to flag is just beside that, you'll see an icon that looks a little bit like a sheet of paper with a paper clip in the top left-hand corner. If you click into that, I've put in the slides that Alison shared, so that gives you the links to all those resources that she had there. So you can click in there, download them, and you'll have them for after this call if you want to kind of get up and running quickly. So look, a couple of more questions that I'll kind of run through. We've one in here, Alison, that might be more for you than for Steve or Dan. Are there many GPs that aren't connected to GP Connect?
No, there's not. There's less than 60 practices. Up until about 18 months ago, that was a larger number. But no, 67 practices have signed up but are not live, and all the rest of the practices are signed up and live. Okay. And that was at March this year, so it might have changed slightly, gone up a little bit, down a little bit, sure. But overall there's very little pushback now, because I work with primary care, with comms and things and their GPs, so that they get updated data. But there will always be one, and if there is issues, please come back and get some support, because sometimes the practice just haven't had the request before. There might be a smaller practice, they don't, there's reasons they don't know what they don't know, so it's very limited. But if you have problems, come this way. But I can confidently say 98%, maybe it might be, I'm not good at mental maths, is actually using GP Connect now.
Excellent. And then again, probably more for yourself, Alison, how is GP Connect different to having an NHS email?
Okay, so an NHS email is just an email, literally piece of communication. You're sending a message from one person to another securely. GP Connect is giving you information in a readable format that we would say as a PDF, maybe an attachment, read only information out of a system, a medical system that the GP holds with them. So email is literally for sharing information and communicating. GP Connect is for you to access information to use for your care planning.
Excellent. And
does that make sense? Because I'm not technical.
No worries. No, that does make sense. It's so much more than just the NHS email. So it just gives you
I'm not going to go into NHS mail and security and cyber security, but essentially for a care provider, I think NHS mail is their extra email address for NHS data sharing, because most providers have their own internal email addresses that they actually use day to day. But from an actual technical perspective, you're getting data from a...
Yeah, no, that makes perfect sense. And then another question are there any costs to signing up?
Not for you guys, no, because OneTouch have done the development, put resources into it to give you this, which is amazing. So no cost to you whatsoever.
No, so get signed up really is the message.
Yeah.
And then and then question in here, and we may not be able to answer this one, but look, I'll ask it anyway. Does this give quicker and easier access than what they have within Liquid Logic, so the LLR care record or the summary care record?
Yes, in a nutshell. Yeah, you get different information and better information through your view in OneTouch than you do through the shared care record. You also get different information that they've put together for that view, because it's a local authority view around commissioning and secondary use of data, whereas this very much supports your everyday working and direct care around that legal basis. So it's similar but different, and I will put my head out there and say it's better.
Okay. Excellent. And then is there a history? For example, when they do medication checks against EMR, do they have to download them to store them for history purposes, or do all the lists save if they need to refer back to them?
I'm going to pass to Steve for operationally how he manages that, because it probably varies per provider.
Yeah, we don't store information, we view it. And because we don't want data being kept for any reason once we've used it. One of my other roles is dealing with personal data breaches and data protection, so I'm always very conscious about asking the teams, access the data for the reason you need to use it, and then you've viewed it, you've used that to check against a particular other document. You don't need to then store that for any evidence, because we actually trust what you've done. So if I needed to go back and check something, I could just go online and have a look myself. So there's no need to store a PDF version of something that's stored electronically.
Excellent. And it is that instant access as well. Like, yeah, it's the same thing as opening up a file effectively. Like, yeah, I get you. That's great. And then this might be one for you, Dan. How do we switch it on in OneTouch? Do they just send a ticket, or do they need access granted per location, or how does it work?
Yep, so basically once they have the relevant code from the NHS, they can send in a customer support ticket requesting it be turned on for the location, and we will set everything up from there for them.
Excellent. And then, sorry, that leads me in nicely to the next question, which is, where do they start? Where's the first place they should go to get set up and get that ODS code? That's the NHS portal, isn't it? Am I correct in that, Alison?
Correct. You was listening, Donald.
It was, yeah. Great. And then
I wouldn't go there before you check your DSPT status, because that is probably the biggest hold up. So once you've got your DSPT standards met status, you can then confidently go onto the portal, fill the national data sharing agreement out, and as Dan said, once you get the information back that you can share with OneTouch, it's called an ASID code, and it just basically tells OneTouch that they can speak to another server, our end, and then for your location you get all the information. That's where I would start. Steve?
I was just going to add, I would you're right, Alison, I would invest some time in getting your DSP toolkit up to date, and it's a self-assessment essentially of where you believe you are in terms of data security and protection, but you will be asked, you may be audited, so it has to be a true reflection of where you believe you are as an organization in terms of having your house in order to make sure that you can keep data secure, your policies are up to date, you've got a register of how you're processing data. So I would say, yeah, get that stage done first. Your ODS code, the NHS talk to the regulators. So if you've opened a new location that's registered, then every month, I believe, there's an electronic exchange of information between the regulator and the NHS, so that the ODS code registered is updated automatically, if I'm correct.
Correct. It's your CQC ID location, I think it's called, officially. But in the background, yes, both sides of what data we collect links up, which is, that only happened about a year ago, but obviously that's brilliant for us because it's just an extra step we don't have to do now.
Yeah, good.
Excellent. And we've had a question just in on where should they go for the DSP PT, but I'd refer everybody back again. If you look at your screen right now, in the top right hand corner, you should see a little sheet of paper with a paper clip on the top left hand side. Click in there, you'll see GP Connect webinar provider. It's a PowerPoint file. It's the slides that Alison ran through for us earlier, and if you click into them on slide 8, I think it is, I'm just going to pull it up here. Sorry, slide 10, there's a list of all of these resources and links to them. So literally just click on that and that'll bring you to those places where you need to get those individual bits. So I'd recommend everybody downloads that deck, and then you'll have access to it in there. So again, hopefully that helps. A couple of more quick questions if I can. Sorry, somebody asks, are you able to order repeat prescriptions through GP Connect? No.
Not yet.
Okay.
It is something that's going to be looked at in the future, but no, you've only got read-only access at the moment to a summary.
Okay, no problem. And then again, we mightn't be able to answer this because I guess everybody is different, but is there anywhere that someone could go to get guidance on what to update in the privacy notice, or is that covered as part of the DSPT?
There is definitely information. Sorry, Steve. There's definitely information. But speaking to somebody practically that's done it, reaching out to a peer like Steve is probably the best way to go. Steve, come on in.
Yeah. Well, I mean, a template suggested adjustment is given to us when we signed up with the NHS data sharing agreement. That there's a suggested text that we just used as a basis, and we just edited that to fit with our model.
Music to my ears, Steve.
Well, if you go on the Alcedo Care website, you'll see it.
Great. That's alcedocare.co.uk. Just get a quick plug in there, Steve, is it?
Yeah. Yeah, that's correct.
Good. Excellent. And then another question in, just asking, will we get a copy of this webinar for the wider team to view and understand? So the short answer to that is yes, we've recorded it. We're going to look to add it to YouTube probably either later on today or tomorrow, I'd say at the latest, and then we'll send you guys out an email after it, just with a link to the recording on YouTube. You can share that with whoever then, and they can watch it kind of at their leisure as well. So that's it. So look, I think we're a little bit ahead of schedule, which is great, but conscious. I think we've had a lot of questions in, and a lot of really good questions in there as well. So I just before we wrap up completely, I'd just like to throw it out to Steve one more time. Steve, top tips for people kind of going down this route. I know you've kind of given us them already, but if you had to do it in a kind of quick nutshell and sum up some top recommendations, given that you've kind of had success with it so far, what would they be?
Get your DSPT toolkit up to date. There's lots of resources on the Digital Care Hub. It's very user-friendly language that they use as well. So they give you some example processes and guidance. That's really helpful. I would say decide on your permissions as well. We're quite clear in our permission structure, where we say, right, that only registered nurses have the top level access. Because they have access to a slightly higher set of data. But most of our office admin roles, anybody with responsibility for transcribing medication or assessing a client's needs, has the view-only access at the standard level. But they have to prove in our terms, they have to prove competency around medication management before they're given access. So that's our own internal control that we apply. So you might want to consider that as well. Yeah, I guess the process is relatively quick. I think ours was slightly longer because we were the guinea pig, but I'm sure that we've kind of trailblazed a little bit. So we've helped you to learn along the way. So I'd say, yeah, DSPT toolkit, get your permissions sorted. You won't have to sell the benefits to the team because they'll see them instantly. Yeah, your GPs are going to love you. So you won't be calling them as often.
And it's free. And it's free. What more could you want? Listen,
Exactly, yeah. Well, it's included.
Listen, look, I think we can wrap things up there. A huge thank you from all of us at OneTouch, really, to both Steve and Alison for hopping on, and then of course Dan as well for taking us through from the OneTouch side of things. Look, really appreciate everybody's time today. Hopefully everybody who joined found it a useful session, and as mentioned, we'll be publishing this to our YouTube channel as well, kind of in the next day or two, so we'll update you on that. But again, look, thank you very much to everybody. Hopefully you all go ahead and get the DSPT done, and then come back to us and sign up within OneTouch, and we'll be here to help with that. So again, thanks to everybody who joined us, and I hope everybody has a fantastic rest of their day. Thanks very much, guys. Bye bye.
Thanks, guys.
Thanks
all.
Bye bye.
Bye.